Hello, I'm Thomas Chandler, and I'm going to be giving an overview of your study subjects, variables, and sample sizes. So just to kind of review, we're still living in the planning portion of our study. And Dr. Kierko introduced this PICO acronym to construct a research question. And the P here is going to stand for our population. So we know we have some target population that we're interested in studying. A lot of times this population is going to be extremely large, so you're not going to want to study the entire population. You don't want to try to study every individual within that population. So what you do is you take a representative sample and you construct your study population. And from this study population is the population we want to perform our study in. And the goal here is to construct a study population that is similar in the underlying characteristics when compared to the target population. So how can we get from our target population to our study population? Well, what we do is define a set of selection criteria, and they can be broken out into two main categories of inclusion and exclusion. So your inclusion criteria are going to help you stay within the setting of your research question. And your exclusion criteria are going to exclude those patients whose participation in your research poses a risk to those subjects or to your study results. A good example of this would be immunocompromised patients. Generally, a patient or individual who's immunocompromised has specific needs in terms of managing that immunocompromising condition. So potentially participating in research for these individuals may be of harm to them. So you may want to exclude them from your study. And when you're defining these criteria, you want to be very succinct, but keep in mind if you have excessive inclusion criteria, it's going to compromise recruitment. So for example, if you want to study community-acquired pneumonia patients, it may be easy to identify patients who are diagnosed with community-acquired pneumonia. But if we want to include a patient who has a pneumonia diagnosis, whose symptom onset was in the last 10 days, who is sputum producing, who has cough, who has fever, now that simple inclusion criteria is more complex and it's going to be harder to identify those subjects. On the flip side, if you have excessive exclusion criteria, your results are going to be less generalizable to your target population. So if we exclude patients, we're going to be left with the study population that isn't really going to look exactly like our target population. So going back to the PICO acronym, we have our intervention, control, and our outcome. And these are all things that we're going to assign to our study subjects, and they're going to vary from one subject to another. You're going to assign some of your subjects to your intervention, some of your subjects to your control, and then you're going to measure an outcome in all of these subjects. So some subjects might have the same experience, but we can expect some variation here. So we can look at these as our study variables. And by definition, your study variables are just going to be your characteristics that are going to vary from one subject to another. And at the end of the day, we're going to use these to provide evidence for that cause and effect relationship that we're interested in. So when you're planning for your study, you want to clearly define your predictor variable, which you may also know as an independent variable or explanatory variable. You're going to want to clearly define your outcome variable, and it's the relationship between these two variables that we're really interested in understanding that cause and effect relationship. But this is two variables in a world of infinite variables. So we can expect to deal with some confounding variables. And these confounding variables are going to be variables that have an effect on our predictor variable and also our outcome variable. So it's going to kind of muddy the water around that cause and effect relationship and makes that cause and effect relationship more difficult to understand and interpret. And we'll go into more detail with confounding later on, but just for now, just know that they are related to both your predictor and outcome. So kind of to recap what we've gone over. So we've talked about our target population, defining our inclusion and exclusion criteria. And then we've also defined our predictor, outcome, and confounding variables. But we haven't really talked about how many subjects do we need to include in our study population from our target population. So if we're talking about how many subjects we want to include, the first question we need to ask is, do we need to perform a sample size calculation for our study? And the answer to that is going to lie in your research question. So if your research question is just to define or to describe something, maybe you want to define the incidence or you want to define epidemiology for a certain disease. Well, we're not really doing any formal hypothesis testing in this scenario. So a sample size calculation isn't going to be needed. But if our research question is making comparisons between two groups, well, then we are actually doing some formal hypothesis testing. So we're going to need to do some sample size calculation. So we're going to be living in this scenario right here. So by definition, a sample size calculation is just a mathematical way to approximate the number of patients that you want to include in your research study to observe the effect that you're interested in. And so why is this important? Well, if we underestimate our sample size, then our results may not generalize to our target population. And we may not observe that effect that we're interested in. And it could end up just being a waste of time and effort after we've completed our study. If we overestimate our sample size, then it's going to require more manpower to do the study. We're going to utilize more study resources, and overall, we're going to increase the study costs. So to perform a sample size calculation, you need to have a set of parameters defined. The first one is going to be your study and null hypothesis. And this is just a formal way of stating a relationship or no relationship between your predictor and outcome. You need to define your predictor variable. And this is how we're going to split our subjects into those two groups for comparison. And then we also need to define our outcome variable, which is usually measured on a continuous or a binary scale. Continuous would be maybe like a change in weight if you're studying an investigational drug for weight loss. Potentially, if it's a binary outcome, then it's going to be something like mortality or recovery, where it's a yes or no outcome. And then you're also going to define your desired significance level, which is also known as your type 1 error rate or your alpha rate. And you can just think of this as the probability of making a false positive conclusion. So concluding that your study results are significant when in reality, they're not. So that's an error that you're making there. And then you also want to define your statistical power, which is mathematically reduces down to 1 minus your type 2 error rate. And your type 2 error rate is the probability of making a false negative conclusion. So concluding that there's no relationship when in reality there actually is one. So 1 minus that is essentially just the probability of avoiding that false negative conclusion. And then you also need to have some idea of the expected effect between your two groups, and then also the expected variability. And if you notice, I went ahead and highlighted numbers 6 and 7. And that's because criteria 1 through 5 are things that we define in our research question and are usually assumed or fixed to a certain value. But with the expected effect size and variability, you have to have some idea of what's going to happen in your study to know these. And if you're thinking, it's how do you know what to expect if you haven't really performed your study in the planning phase yet? So we know the objective of our study is we want to estimate the difference between some outcome between two groups. And we are doing a comparison, so we need to perform a sample size calculation. So we need to have some idea of what that difference might be and what the variance might be. So how do we know what to expect if we haven't done our study at this point? But we do have some methods of estimating the effect size and variability. You may have results from a smaller pilot study available. You may be able to look in the literature and find previously published values. You may survey experts in the field to get a better idea of what that effect size and variability might be, or you may have some personal knowledge or opinion. And at the end of the day, all of these methods are subject to some pitfalls. They're not going to be perfect or exact, but performing some sample size calculation is always a better choice than just making a random arbitrary choice. And one thing to note about effect sizes, when we're talking about effect sizes in clinical research, we're usually talking about the minimal detectable difference, which is just going to be the smallest effect that is clinically relevant, but also biologically plausible. So I think it's always good to have some type of visual to assist in learning. So let's say we have 2 study arms and we're interested in studying the length of hospitalization. And so study arm A is just going to be our control group, and we think that they're going to be hospitalized on average for 6 days. And then study arm B is going to be our interventional group, and we think our intervention group is going to be hospitalized for 2 days. So the estimated effect size that we can expect would be 4 days, which is fairly simple. But let's say instead of study arm B being hospitalized for 2 days, they're actually going to be hospitalized for 4 days. Well, now our effect size that we are estimating is 2 days. So which effect size do we want to use in our sample size calculation? Well, depending on the one we choose, there's going to be implications in the total sample size needed to do our research. So if we have a larger effect that we're estimating, we will need a smaller sample in our research study. And if we have a smaller effect that we estimate, we'll need a larger sample to do our study. And you can just, it's pretty intuitive here. So if we're expecting a larger effect, then that difference is going to be larger. So it's going to be easier to detect a difference. So you'll need a smaller sample size. If there's a smaller effect, then there's going to be a smaller difference. So it's going to be more difficult to detect that difference. So we've discussed the effect size. So we can go into a little bit more detail with variability. So variability is just going to describe how our outcome varies between our subjects, but also how our subjects vary from the average value. And this is important because it lets you know how your outcome is distributed, and also if there is any clustering around a point, and how basically how our outcome is going to be distributed. Is it going to be skewed? Is it going to be normally distributed? Just tells you how that data is spread out. And when we talk about variability, we usually summarize it with the population variance. But if you remember, our population is extremely large, and it's not very pragmatic to try and study our entire population. So we're never really going to know the true population variance, but we still have those methods of estimating the variance that we discussed earlier, potentially from a pilot study or published values, personal opinions, et cetera. So let's go back to our 2 study arms, and let's say we estimate the variability. And if we look at these 2 distributions, we can see that, they follow pretty much a normal curve. They're centered at their sample mean. But if you notice, if you look at the tails, there's some overlap there. And basically what this is telling us is that there's subjects in both study arms who experience the same outcome. So if we lower our variance and we expect a smaller variance, then we get these thinner distributions, and there's less overlap between our 2 distributions. And so depending on the variance that we use in our sample size calculations, there's also going to be implications on the total number of subjects that we need to include in our research study. So if we have a larger variance, we're going to need a larger sample to detect that, that minimal detectable difference, just because there's less consistency in the outcome. as you saw, the two distributions may overlap. So it's more difficult to detect that difference if one exists. And if the variance is smaller, then it's going to be easier to detect that difference. So we will need a smaller sample size to do so. So the main takeaway here is that depending on the values that we assume for effect size and variance, it's going to affect the total number that we need to include in our study. And just a few final things to note with sample size calculations. In the retrospective setting, such as a chart review, you can use sample size calculations to determine a number of cases that you need to collect and review. We talked about type 1 error and power earlier, and these are usually assumed to be a certain value. But if we make changes to these values, then it's also going to influence the total sample size in our study. And sample size calculations are generally performed on your primary study endpoint. So you may have secondary endpoints that you're interested in, but we don't normally perform a sample size calculation on those secondary endpoints. And as expected in clinical research, you will lose some patients to follow-up. So there's a way you can adjust these sample size calculations with the dropout rate to account for those patients that you may lose to follow-up. And with that, that concludes our overview of subjects, variables, and sample sizes. I think next is Stephen.